a lot of background feed. I just want to say thank you to Julie because I know she's put a lot of effort into this video chat. It's all new territory for her and everybody else. So I just hope and pray everybody's been doing well. And, I think we can only imagine ourselves being in Indianapolis in one room together. So even though it looks like the Brady Bunch screen that we're looking at. Good morning, Representative Summers. I'd like to go ahead and get started and we'll get going. I think we're going to start with Terry Stiggin with DCS to give us a report. And we're going to try to keep each presenter to 3 minutes and respect everybody's time.
Thank you, Chair Devon. So DCS, we're trying to stay on top of federal guidance from the Administration of Children and Families and also from the Children's Bureau's Associate Commissioner Jerry Milner. So we've had a lot going on, but I will give a high-level summary of adjustments to operations. So for children and families, we started pre-screening through the hotline on February 28th. To determine if there was anyone sick in the home based on what we were hearing from health and through the media as far as exposures. So we wanted to get a jump on whether or not there were sick people in the home there. Currently, and even since the changes with the stay-at-home order, because DCS is an essential business, and our workers are considered emergency workers, initial abuse and neglect allegations and child safety concerns with open cases continue to occur face-to-face. You can't virtually assess safety, especially when you've never met the family or been in the home. With older youth, we have weekly contact with our older youth. Those are our foster youth that are in college or working but still engaged with DCS. And our supports continue even if older youth are over 23 years of age. We connected with our youth that had that were no longer with DCS, but we had contact information to make sure that they had access to food and other resources that they might need. For resource families, which are our relative caregivers, kinship providers, and foster parents, our licensing specialists have been doing weekly check-ins with the foster parents to make sure that they have their needs met. And there have also been some churches around the state that have helped to provide supplies and food to help support those families as well. And we also submitted a foster care survey to determine how well we could adapt if we had children that were COVID positive and needed placement for them. We had more than 3,400 responses from foster parents, which was very encouraging that we got that feedback. And for our workforce, remotely working wasn't too difficult to do. We accomplished it very quickly, and for at least our child welfare workforce. And so they're working remotely as much as possible and working with the PPE we're able to get and providing training on PPE. As far as how people can help in the community, family supports are critical, so we ask that people pay attention to what's happening around them when they go out for walks, drop off food on people's porches if you know that they're in need, fact check what they see, make sure that the information they get are from reliable sources. There's a lot of misinformation out there, so we really ask that people fact check and to have a plan for who to care for your children in case you become incapacitated so that they don't inadvertently become wards of DCS because we don't have anyone to take care of your children. And then last, as far as future planning, we have already started that, looking at what we can continue, start, and stop within the agency, leveraging virtual capabilities as much as possible, and continuing to evaluate our continuity of operations plan and looking at how we can do some type of virtual exercise to determine how we will return to work and any future response to a pandemic or mass casualty or emergency. And that's all I have for DCS.
Thank you, Terry. And I don't know if I'm going to allow any questions at this point from any commission members. So we'll move on with, and then if you have questions, you might write them down, and then we'll try to make sure that each person gets the appropriate question to get an answer.
Oh, good morning. Everybody hear me?
SSA?
This is Jay Chaudhry. I'm the director of the Division of Mental Health and Addictions at FSSA. I'm only here to give the DMHA update. we've been instructed to hold off on interim updates from FSSA for the time being. But at DMHA, we have been very cognizant from the beginning that we have kind of a slow rolling crisis within a crisis of mental health and addictions issues that are going to be exacerbated by the current situation. And so just a few things that we've been working on kind of across the board. We've been offering our providers sort of maximum flexibility to use telehealth and telemedicine services, and have been very pleasantly surprised by the adoption and the impact of that. We have stories after stories, and we're working on turning those stories into data of people that otherwise would not have access services be able to access it because they can do it from the comfort of their own home. It's a little trickier, I think, with some youth and family services that we provide, because some of those services, like our respite services, for example, the model doesn't necessarily work in a remote setting, but we've been working on creative ways to work around that. From a school-based mental health standpoint, a lot of our school-based providers have adopted telehealth and have done sort of the telehealth home visits, and that's been a pretty seamless transition from what I understand. And then one thing that we're very excited about, we worked with DOE to develop a survey that was given to school counselors and social workers to kind of develop or determine the level of contact with students and families, as well as any identified extra mental health needs. And so we've had over 300 responses to that, and the survey just closed yesterday, and so we're working through that information, and we'll hopefully be able to glean some good stuff from it. So, I think that we know that the mental health impacts of this are going to last probably far beyond the current pendency of the stay-at-home orders and the pandemic, and so I think we're planning on a long process of just beefing up the support that's available to folks, because I think we all know it's going to be needed.
Thank you, Jay. Eldon, standing in for Department of Health for Dr.
Good morning, everyone. My name is Eldon Whetstone, and I am our Health and Human Services Assistant Commissioner. Thanks for the opportunity to join you today. Much as Director Stiggan alluded to, we've changed our wholesale operations. Hardly anybody is at the Department of Health right now, but people continue to work remotely. So some initiatives that Julie asked me to focus on, such as OB Navigator. OB Navigator is continued to operate pretty much as normal, except that all of our staff, all of our communication specialists that conduct the calls are doing that from their homes. It's something like a real challenge that you wouldn't think about. This is kind of funny, but yesterday we were on the phone talking about we're having problems securing enough headsets for our call people. There's just such a demand for headsets right now that all of them are back ordered. But we're working to address that issue. But otherwise, we launched in Grant, Delaware, Henry, and Madison counties last month, and we launch in Lake County next week. So that will bring our total to 7 counties after we bring on Lake. The calls are going well. We're getting a pretty good response rate. Comparing to other home visiting programs, we weren't expecting miracles, but so far we're seeing good response rates. So we're encouraged by that. The WIC program, all WIC clinics are pretty much closed, but all the staff are still seeing WIC clients over the telephone. So all appointments are being conducted via phone. Both existing clients and new clients are continuing to be served. So, and actually we've seen an uptick in new appointments and kept appointments. So certifications are up over what they were last year. People, and WIC has also modified their food guidelines to allow more flexibility in the grocery store. As we all know, Some stores suffer from a limited supply, so WIC has expanded what is allowed to be purchased with WIC benefits. Overall, WIC is doing well, adjusting to the new norm. Another food bank, the WIC also oversees our food bank program, which is the Emergency Food Assistance Program, TFAP. So we have twice weekly calls with all the food banks across the state. As I'm sure you've heard, their volume has increased exponentially. So some of their biggest challenges are a lack of volunteers, just because we know that people are staying home as the governor has directed, and also many of their volunteers are unfortunately maybe people that are older, retired. So their needs are volunteers and just more resources. Like I said, due to the increased volume, they're going through food faster than they ever have before in their history. So that is their primary needs. But otherwise, they've all adjusted to go to drive-through models, so people just pull up and the food gets put in the trunk and they move on. So that is working pretty well all across the state. Food banks have been tremendous in adapting their models. Our Children's Special Healthcare Services Program, it's again gone remote, but all the services are being provided. So people are just, it's unfortunately still kind of a paper-based system. We haven't been able to migrate all electronically yet, but we're working through. People are emailing forms, emailing documentation, and our staff is processing that as normal. So that continues to work well. Then just lastly, our Center for Deaf and Hard Hearing Services continues to serve students across the state with assessments. So they're doing that remotely, and I said they do visit homes as the parents. It's kind of up to the families. They leave it up to families to decide how they want to be seen. So that is working as well. We're overall change of operations, but still continuing to provide services.
Well, then thank you for that. I know it's been very challenging for you and for everybody in your department. We appreciate all the hard work you've been doing. You're not related to Matt Whetstone, are you?
I hear that a lot, but no, I am not. Thank you.
Okay, next would be Robin within the Interdepartment of Education.
Hi, everybody. I am here to provide an update on what we've been doing with the Department of Education, and we have been working closely with some of your agencies. I know we've worked closely with DCS related to foster students and putting out guidance to schools in regards to how teachers can still be mandatory reporters and look out for some warning signs or some risk factors for students as we have transitioned to remote learning. At the Department of Education, we are working remotely. Everybody is working remotely at this time, so we've taken that step for some social distancing. As far as our work with our constituents, we have bucketed our work into 4 buckets, including one being providing resources. And what we've done with that is worked with schools on how to get food, breakfast and lunch and meals out to all of their students, which has been a big undertaking. We worked with the USDA to get some waivers and make sure that we could provide the food needed, and worked with schools on how to keep their people employed so that they could deliver those meals in a way that encouraged social distancing, whether that be drive up or pick up spots, using buses and bus drivers to deliver meals. So meals has been one of the areas where we've been heavily involved. Working with the EOC, we have helped provide a lot of PPE equipment that's been distributed to hospitals, healthcare facilities, nursing homes, by asking our schools to sort of raid their CTE and science closets and donate the PPE equipment that they had in their schools. Additionally, they needed 6-foot tables and folding chairs for some mobile testing in hospital units. So we were able to secure those from a school district here on the east side of Indianapolis. Warren Township was able to donate or lend all of those tables and chairs to the EOC. So that has been one of our buckets, was providing resources that are needed during this period of time. Another bucket was academic support. So we have collected a robust database of academic resources for teachers and parents that is searchable and filterable by grade level and subject. Within that, we have over 4 pages of social emotional supports. We've released the student happiness course for students in grade 12. We have started the Hoosier Healthy Challenge to encourage students to be active physically during this period of quarantine and stay at home, where they can do physical activities on a bingo card, and then when all this is over, get some prizes from businesses. We have done our weekly learning challenges, choice boards, which many school districts have adopted to help students do some interactive and engaging activities that are aligned with Michael Fullen's 5 C's. So we have many districts using those as part of their at-home learning. We've been assisting all 746 school districts, both charter and public and choice schools, create continuous learning plans that allow the community and us to know about how they're grading, how they're communicating with parents, whether they're offering credit, how they're taking attendance, what kind of remote learning experiences that they are offering. So that was another bucket. And then providing guidance. We worked with DCS on some guidance. We've worked with FSSA to get some data on where childcare might be needed for healthcare workers. And we worked with the Indiana Physicians Association on that as well. And then provided guidance to schools on what that could look like if they were to open a child care for emergency responders and essential workers in their schools, and how to do that safely and protect their students and families. So that is a short, brief summary of all that we have been up to at the Department of Education. Certainly not comprehensive, but I think that highlights the important pieces.
Thanks, Robin. Robin, real quick, on those areas that don't have Wi-Fi, are they still trying to
Yes.
educate?
So we've got a couple things going on. One, we have schools spending some money in advance, knowing that they're getting the CARES money from the federal government to provide hotspots to their families. We have some school districts doing the Wi-Fi buses, including South Bend, and then schools where we're still seeing the connectivity as an issue. We have worked with them on providing some not only paper packets where students come and pick up packets and then turn those back in. Additionally, we partnered with IPBS, Indiana Public Broadcasting System, and they have released some programming so that if students don't have connectivity but they have a television, they can watch some programming that is educational and do some packet work on that. And we have also included all of our activities, our offline activities in the database. You can search offline activities, which include those choice boards and templates that we've provided on how to watch a TV show or read a book and do paper activities that then schools can collect.
So do you feel like there's no reason to hold this year's, have kids go back and take this year all over again?
Correct. I do not think it would be necessary for a mass retention or redo. You know, we were 3/4 of the way through the year before this happened, and for this last quarter, I think they've been able to, although maybe limp through it, I think we've been able to, we'll be able to cross the finish line.
Good news. All right. Thank you for that. Next, we're going to go to the governor's office with Zach Johnson. Is he not on? Okay. All right, John. John Hammond, you look different with your beard, but good luck that you're up.
He's just
Can you
talking.
unmute?
Hey, can you?
John, can you unmute your button?
John, it
Can't
looks
hear
like
you.
your microphone is on mute. If you would please unmute.
And Representative Devon, this is.
Maybe he has speakers
Can you
on
hear
and
us,
he
John?
can't hear us. Tell him to unmute. Can you chat him in the?
Chairman, this is Zach Jackson with the Budget Agency. Can you hear me? Okay. Well, yeah, I was trying to get my line unmuted
Yes.
earlier, but I can
Are you
provide
with
a
us?
quick update while we try to get John figured out. Okay.
Okay.
So, as everybody's aware, the
That would be great.
COVID-19 pandemic is not only causing a health crisis, but also a corresponding recession. As we're looking at state finances for this year, we started the year with about $2.3 billion in the general fund and combined balances. On March 23rd, I issued guidance to state agencies asking them to go ahead and try to maximize the amount of reversions or dollars that they can give back to the general fund this year. We started this year with 2% reversion targets for most agencies. Ironically, during the Great Recession, we started, I believe it was fiscal year 09, with 2% reserve targets, basically asking agencies to underspend their budget, their appropriations by 2%. By the end of the year, we grew those 2% targets to 10% targets. And then the following fiscal year, that became 15% targets. We have not yet set guidance out for state agencies for fiscal year 21. I anticipate that information to go out probably between May 1st and May 8th, after we get the results from April revenues. Typically, April is our biggest revenue month of the entire year. The state brings in over 17, almost $18 billion of general fund revenue, with dollars coming in April alone. But with the slowing of the economy, as well as tax day essentially being shifted from April 15th to July 15th, we're expecting a significant amount of dollars to be pushed out of this fiscal year and into next fiscal year. I wouldn't be surprised if we miss our target for the month of April by at least a $500 million. The $2.3 billion that we have in the bank will help us. We will be operating at a deficit for this year and next year, but that should give us enough cushion so that we can try to reduce expenditures statewide, but still try to support some of those most critical services. We are receiving a substantial amount of money from the federal government through the CARES Act, but so far there's not a ton of flexibility that comes with those dollars. And so we literally received $1.3 billion on Friday of last week for COVID-19 related expenses. But to date, our COVID-19 expenses have been less than $30 million. And there's not a lot of flexibility so far with using that 1.3 billion to just address shortfalls that we have elsewhere in state government in terms of yes, there's an appropriation for something, but we don't have revenue to back that appropriation. And so far, that's not something that the federal government has given us that flexibility. There's still conversations going on at the national level about giving us that flexibility, but so far, it's just not there. Monday night, I sent out a financial management circular to state agencies. Financial management circulars are the budget agency's way of issuing rules to other state agencies as far as how to manage their finances. And so it basically called on agencies to undergo a number of belt tightening exercises as we weather this financial storm. That said, I'm happy to take any questions.
Dale, can you make sure your mic is unmuted?
Yes, thank you. John, next would be John Hammond. Are you with us now, John? Nothing yet? Can you hear us, John? We still can't hear you. Are you unmuted?
John, it looks like your
Can you
microphone
check
is
your
not turned on at
microphone
all.
volume,
Not
maybe?
that you're muted, but you're not even on. If you look at the little microphone icon at the top of the screen, make sure it's green.
As part of budget reduction, we had to get rid of
John, you could also, there's a little down arrow next to your microphone. If you click that and go down to adjust volume, you can increase your mic volume. If you'll try that, because I think I can barely hear you.
Hello?
Thank you.
Can you hear me now?
Yes.
Okay, I switched microphone. I'm sorry. Thank you for the technical assistance. Sorry, you can hear me?
The floor is yours.
Can everybody hear me? Great. Thank you. I just want to take a moment to thank Terry and her team, and obviously everybody that's trying to do everything remotely. The challenges for DCS, and Terry only had 3 minutes. She could probably write a whole book about the first week or two of going through all this and running that agency, and they've really just done a heads down job on all of this. And she's right. You heard from Zach on sort of what the new normal is going to be as far as the way we're going to need to prioritize our own kind of government services, spending, etc., even more than we already do, which is what state budget agencies working with agencies on. But then there's the task of trying to figure out, to the extent we can, open various items back up for essential services, customer-facing services. We've managed to keep most of our essential services open in some way and change the way we do business in a whole suite of areas. FSSA comes to mind, and the essential services that they provide are very quick and nimble, as if they sort of prepared for this very early on, well before March 6th when we first got our case, or March 16th when we had our first death. I'll just run very quickly, and I've got to go. As you can see, sort of at the office at the moment, and so our rhythm is picked up more than usual. And we didn't really have a lot of breathing room from when Dale Devon keeps us busy and the first case. But we've been working closely with sort of our legislative partners. I have a standing regular call with a number of legislative leadership. The governor visits with them frequently to keep them up to speed, particularly as we're getting the federal funding is coming in, some of which I think we've tried to describe on some of the daily briefings to the extent that you tune in, is discretionary. Others much more formulaic in the case of Department of Education that I think has yet to receive some of their larger tranches of money from the CARES Act. Nearly 500 million, I think, is coming their way. A large part of which I think is some formula-driven spending with some discretion and a bit of a longer tail than some of the other CARES Act money that must be spent prior to the end of the year. We still await some guidance on the stabilization fund, which is the 2-point-some billion dollars that the state of Indiana should get. Again, all of that, some of that, or much of it, potentially already spoken for, but we have started to receive money from the Department of Education that is a little more discretionary, much smaller chunk that is at the discretion of the governor. And so we're working through the best way to prioritize the needs there in conjunction with everything else we're doing with state agencies and working really closely. I'm very happy with the Department of Education really from the beginning. We've had a very good, whether it's FSSA working on the food items that Robin mentioned, and I think that there's always a lot of overlap, but I think the standing up some of these things in short order around the state to provide really essential services, food, shelter, and childcare, etc. Those resources, I think, are as good as they ever have been. FSSA's got two that I just sort of point out and we can sort of send around. I'm sure everybody's already seen because we've been trying to promote it. One's sort of the food availability piece that Jen and her team sort of, I'd say we already had some of that, but really tried to bolster that. And then also the child care finder. So for those that we have allowed or tried to provide guidance for the ability for child care facilities to stay open as essential workers still need to get to and from their jobs or have other obligations while we're under the stay-at-home order. Those are both really good tools on FSSA's website. Another thing, I was in and out of stuff. I know Jay's team has been working very closely on some upcoming resources, mental health. I've been privy to some conversations. I think they're near a launch on what's going to be a pretty great mental health tool, nimble tool that I think we're going to see launch here shortly. So I won't step on that, but I think that there's a lot of frankly good things that have come out of this that hopefully are long lasting as people have had to think pretty quickly and redirect resources towards. So those are all things I think that relate to the constituency and families that we talk about and try to help drive policy towards. So I just wanted to talk a little about that. There's a whole series of things that we're dealing with sort of on a daily basis that are interesting. We're obviously trying to track more regionally on what services look like. Not only are we trying to figure out what the right way is, which will vary regionally for how businesses open, but that's also going to include some of the providers that haven't been able to provide that same level of service. It's whether it's in Terry's world or in FSSA. So really trying to work through that. I think in the interim, we've been trying to help some providers understand what assistance is available to them, help provide technical assistance, whether it's on the payroll assistance or other avenues that are coming into us, or we're getting a lot of information from the federal government on guidance, and really trying to make sure that's relayed through our agencies to help continue to prop them up so everybody's ready to go when we're back at full force, even if it's under sort of a new normal. We continue to deal with, the biggest risk I think you hear about all the time, obviously, is long-term care facilities and prisons are, but I think some providers are also under the same risks as you're in a contained facility. That as a model that is harder to deal with and that requires a much more hands-on approach when there is the beginning of an outbreak, and that's where health and their strike teams have really, both on a long-term care facility, prisons, or other facilities, has really been able to act quickly and get that stood up. I believe for the long-term care facilities, we're well into the double digits for those teams, and then we have a number of other teams that move around the state for different types of facilities that might include prisons and others. So I don't want to get too far down the weeds, but I did want to touch on a couple of those really essential tools, because when we think about the things that are affecting children that we talk about, food, the shelter, the benefits, I think we talked a little about WIC and some other things that we did early on to provide waivers to allow some of the innovation and not let rules get in the way of getting groceries or food for mothers or children. So anyway, I'll leave it at that. I'm happy to stay on a little bit, but I will have to go here in about 5 minutes. So if anybody had any questions now, I'm certainly willing to try to field those.
We'll go ahead and open that up. And I guess, John, my question would be as we start to hopefully open up the doors just a little bit, and I know a lot of it's based on business and discussion on businesses, but I've been getting a couple calls from our churches. And is there any guidelines? Should we create our own guidelines for each church? Because, you got a church that might have 30 members, and I've got churches here that have 4,000 or 5,000 members, right? So each type of standard might be different for different levels.
Yeah, right now there's some really good CDC guidance for sort of faith leaders at the moment. But certainly we would approach those as we would with kind of any events or gatherings. I think that's going to be, as we start to transition in some of the larger churches, the larger gatherings, the larger events, you can contemplate concerts and other things. That's almost its own sort of beast, so to speak. I think the governor's talked a little about this. What we've done initially is, and we have a lot of input coming due today from business associations on how they might envision transitioning in, what the how looks like. How would they conduct business if they were to open, assuming a lot of the trends, if we start to see a plateau here. So that's the point of discovery we're in. Then we're going to move on to sort of what I call the mass gatherings piece, which is how can you safely hold, like you said, Representative, a service or a concert, or whether it's outdoors or indoors, and what might be required on PPE, et cetera. So we're sort of trying to do this in a very deliberate manner so we can understand, and I think so the public can also have confidence, because we're not, if we opened like a light switch, which we won't tomorrow, we understand that still the consumer, the general public, whatever you might name it, is going to come back a lot slower. And so we want to instill as much confidence that whether it's the industry, and in industry it could be churches, et cetera, are taking the proper precautions so they can welcome people back when we start to ramp up here, which we're hoping to do. Obviously, we want to come out as soon as we can. So it's a great question. For those that have specific industries or others that have reached out that feel like they've got something to offer into how they might, I'm not talking about individual businesses or groups, but could be, feel free to reach out to me. I'm always happy to sort of send them some sort of kind of what I'd call instructions and a letter that they then could submit sort of a plan. And it's not something we'd approve. It's just really just to give us an idea from those that conduct that business, how they might do that. And so we think that's really important, since there's so many variables that go into opening back up. So.
Any other questions from commission members?
Thank you.
Thank you, John. Tell the governor we thank him for all his hard work as well.
Governor gave a nice shout out to the courts yesterday. I think he said moving at the speed of need. So I'd be remiss if I didn't recognize all the others that are on this call, and obviously really probably working overtime today, whether it's Attorney General's office or Department of Ed, et cetera. So I know I look like I'm maybe the only one in the office, but I know you all are working probably much longer hours than normal. So we really thank you, because it's been a really great partnership across all.
Thank you. I am glad there's captions because I've only heard about half of what's said. Is anyone else having trouble hearing the speaker? So I'm reading along, but your voice is cut in and out. So put a thumb up if you can hear me right now. Can you hear me? Okay, some of your thumbs aren't up. Okay, well, I'm going to talk and you can read. The courts are open for essential emergency operations. We have a rule that requires a continuation of operation plan, so they already had to have one in place. We have 105 different continuation of operation plans. When you look at the 92 counties and then the small claims courts, they're all a little bit different. And then we as the Supreme Court have issued some orders on top of all their orders, dealing with things like civil writs. Where we held that if like a mom or a dad has a debt case out, they can't go to jail while this is pending. A civil writ is where you're picked up for not showing up at a hearing and you're in jail until you have to post bond or something else. So we suspended that. We had a lot of questions come in, a lot of fighting with families on what the parenting guidelines. Is this if school's in session or not in session? We have a family law initiative, and we issued an order saying that it's as if school is in session, to just bring that the fighting, the chaos on those issues. That the clerk's office are closed. How do you pay child support? So we've issued orders on child support. We requested our judges to look at detention facilities and determine if they're low-risk, nonviolent juveniles that can work with their community, work with the prosecutor, work with probation, can be released. And we've made calls to detention facilities. In looking at that population, we've done the same thing with adults. And I saw some numbers, and they're pretty big numbers with regard to low-level nonviolent offenders in jails. The issue of DOC is it's a different issue. So we're working with DOC with regard to their protocols. I mean, it's just not a great situation. There is no mechanism for judges to release somebody from DOC. It has to be done pursuant to a petition and a hearing or executive branch. So we're looking at that. We had our Juvenile Justice Improvement Committee and Indiana Conference Juvenile and Family Court Judge give guidance to trial court judges on visitation during the pandemic and how to safely do it. We have a COVID website that have all our orders on it. A lot of judges had a lot of questions. I know foster parents contacted us with regard to safety issues. We are getting information nationally from the Children's Bureau of best practices, and then we're getting it out to the judges. Today, we're extending our court's emergency order through May 18th, and we've got a team of people working on how to do a soft reopening. Again, courts have always been open. Some counties are cooking and doing remote hearings, and we have the client and the attorney in a separate room, being able to talk confidentially. So we're looking at the funds that we have and getting even better technology out and trainings to our judges. We have a lot of issues like, when do you call a jury? I mean, when is it safe to bring 50 people in a small room? We have a lot of work to do with regard to getting the courts back to business, and I respected what John Hammond said. They're dealing with that all over. So we're dealing with child welfare hearings. And Terry, if you hear that something stalled in a county, you reach out to us. You reach out to Justin or myself or Justice David and let us know, because those are essential hearings and they're to go on even in the middle of the pandemic. Anything regarding child safety. We're going to have a lot of issues with regard to time frames as we start peeling out of this. Every county might look a little bit different. Getting the courts up and running in Marion County is going to look different than Jennings County. We're really asking our judges to work with their Department of Health, their county council, commissioners, prosecutor, all their justice partners on coming up with a plan. And I think it's going to be slow. I mean, I think it's going to be slow. We have some courts that are doing lots of things remotely, and we have some courts that have kind of stalled, and we're reaching out and doing some training and coaching with those courts. I really worry about the child welfare cases right now with the lack of eyes on these children, and I think there's going to be a lot of, Terry, I think you know this too, there's going to be a push once things start opening up again with regard to get numbers from MPH on addictions. Addictions are way up. Overdoses are up. in rural counties and big counties. Probation with regard to drug screening. Problem-solving courts are trying to get things done remotely, but we know with our addictions community, those self-help groups, virtual isn't as good as in person. So we've got the pandemic going on. I also worry about the drug epidemic going on, and we've got to get some better practices going with regard to that. The governor's office has been great, kept in touch with us. We've worked on a couple things together. They're in there every day. I mean, I was going down to the State House a couple of days a week. Justin is there every day. That governor's office is packed with people every day. There's so many things they're trying to deal with right now. So we'll have COOP plans, which is continuation of operation plans for every county, which does make it hard for some of our partners in DCS. Some may look from one county to another. I think that's it. Justin, can you think of anything else child-related, child-family-related? Justin Faulkner.
Just a couple of things, ma'am and Representative Devon, if I can just slide ahead there on the agenda, and we'll merge our time together. That soft reopening the chief mentioned, that will include our staff, virtually all of whom have been working remotely for about, I don't know, a month or more at this point. So we'll start phasing them back into the office as well. We've also given out guidance this morning on how to conduct remote hearings. So we're doing a lot of those in some of the juvenile and family proceedings. To some extent, those will stay, I think, in some form or fashion past that May 18th date, and then maybe even going into the future. Some of that's just the way of the future, so we're trying to arm our judges with those, with Zoom licenses, with whatever technology they need, so that those can be integrated where it fits within the normal judicial system. And I just want to kind of echo what the chief said, thanking everybody we've been able to work with on this. She mentioned the juvenile facilities and looking at the release of low-level nonviolent individuals, but DCS, ISDH have helped our general counsel work with those facilities as well on just how to social distance within those facilities on the folks that aren't able to be released. So that's been very helpful, and working with the governor's office has been very, very good. They've done a great job of keeping us on pace with what they're looking at so that we don't feel like we're getting behind, so that we can approach this.
Thank you, Justin, and thank you, Chief, for all your work you've been doing. And I know it's been difficult, starting all over again. So next will be Chris.
Good morning. Can you all hear me? Yes. Okay. Thank you. Thanks. So as you know, juvenile facilities. Well, first, before I start this, I'm going to focus strictly on what we're doing in our Division of Youth Services facilities. So most of my discussion will be just on that. So, but obviously we're essential in our facilities. All of our staff in our facilities are reporting to work unless they're off for being sick. Intakes, but except in our central office staff, everyone is pretty much working remotely, with the exception of a very small group of us that are still here in the office. So I am coming to the office. Our intakes are down, which has been a great thing. One of the things that they are doing is the counties, when they're coming, or the detention centers, whoever's bringing those youth, they are screening those youth prior to transporting them. We're screening them once we get them. That's going very smoothly. We have weekly calls with our daily, sorry. We have daily calls with our wardens every single day, and that's adult and juvenile wardens. So we're giving them information, they're giving us information, they're giving us updates on what's going on in their facilities, any changes in movements, any changes in positive cases, anything like that. That's being discussed. So those go really well. We have them every single day. Our staff and youth have really continued to remain very positive, and they're coming to work. They're doing work. I mean, clearly we still always have vacancies and we need staff, and so that would be definitely something that I would say that we would definitely want to get the word out, is that we're still hiring, we're still taking people, we need staff. Our movement in our facilities has been, we're moving in cohorts. We're still operating though, pretty much doing in our juvenile facilities business as usual as far as having school, having activities, having rec, but we're doing it in smaller groups. So not everybody is together, doing very small cohorts, small classroom sizes, things like that. Lots of events that are taking place on the units so that we're keeping that same group of kids together. Families have been pretty understanding because we're, not allowing visitation, but we are providing ways to communicate by phone, and we have tablets in our facilities so for our kids, so they're able to call their parents and their families when they have those tablets. So that's going well. They're still able to communicate. We do have access to some video visitation, and that we have that also. Every youth and every staff in our facilities have a mask, so they're wearing masks when they're out and about. Our release processes haven't really been hindered as far as what we're doing, and still getting the kids out when it's time for them to go. So that hasn't been the issue. One of the things that we're really doing right now is, clearly our chief medical officer works very closely with ISDH, so we're all working very collaboratively together. One of the things that we're doing now is that we are really focused on now moving forward and future operations. So we have a team of people that are meeting virtually and some in person to talk about what, we have those daily warden calls every day where we're talking about daily updates, but now we need to start thinking about moving ahead and future operations and what might change down the road, even if things are done a little bit differently. So kind of a brief update on what we're doing, and if anyone has any questions, I'd feel free to answer them.
All right, thank you very much. And if I think at the end, if people have questions, I think we'll be out of time, but maybe we can use the commissioner, Julie, they don't have direct contact to reach out to each of us. With that,
Thank
next
you, Representative
we have
Devon.
Susan
Can you all
Lightfoot with
hear me?
probation.
Okay, thank you.
Here.
I think probation, like the courts, as Chief Justice Rush indicated, is a little different in all 92 counties, and we are operating under the orders and directive of our judges specifically. We have gone to reduce staffing in the office, and the other staff are working remotely from home. We are practicing the social distancing and supervising our clients and families via the phone. Our courts are only doing essential hearings, and those are being done either through video conferencing or over the phone. I think one thing that's been positive with our staff is we try to keep positive attitudes, a lot of humor going, and we have a group text where we check in every morning and every evening. We have shared amongst chief probation officers across the state things that are working and things that are helpful. We are meeting with clients via phone, Skype, Zoom, and actually our clients and their families seem very happy to hear from us. And we may even have more time to spend meeting with them just because we aren't spending as much time in court and doing other things in the office. I think it's been positive for our staff to model positive attitudes to our clients and be encouraging in them establishing new routines to include exercise and positive activities with their family. We're trying to provide them with resources as far as
She freeze up. Susan?
It looks like Susan froze. If you want to, she'll reconnect if you want to move on to another speaker while.
All right. We move on, Julie. Okay. Denise, are you ready?
Can you hear me?
All right.
Great to see everybody. Julie, FSSA team, thank you guys for this technology and helping us meet this way. It's great to see everybody's face. Just as an update on the public defender side of things that we're working on that relate to children, PDC and state PD have been working together to provide training to public defenders in this time to help deal with issues that are not unique, but accelerated in the moment, helping problem solve any issues that might come up with CHIN's visitation, providing training on relevant motions and advocating for families in this unique time. The state PD has been seeking release of juveniles who are in detention, and the state PD has had some success in getting appropriate children who would be appropriate to be released. IPDC and state PDC are also preparing and have prepared and shared forms for juveniles committed in DOC facilities that have reached level 3 of their growth phase to use that as a basis for an opportunity for release. So that's the work that we're doing related to COVID-19 in this time. And this might be more of a question I can talk with Chris Blessinger separately, but one thing that has been a concern for PDs is secure detention facilities that are not DOC facilities. It would be very helpful to get a report from them, just, how are they keeping the kids safe, different practices. I do have a survey that the state of Michigan put together for their detention facilities, just to get a survey on, what are the facilities doing, what do their populations look like, et cetera. And I think that would be really helpful for this group to have, for JDAI, for a lot of stakeholders to have, just to make sure that everybody is doing the best that they can to make sure that the kids who are in secure detention are kept healthy and safe as best as possible. So with that, that's...
Bernice, I've got a question, or I've got something. Bernice, we had our general counsel, Brenda Rodenheffer, contact every detention facility and get information, and we can share that with you because we shared your concerns. So, Justin, can you put Bernice in touch with, you can just nod your head, put Bernice in charge of Brenda, because we did that probably in the first week of the of this happening. So, but then it surely probably could be updated. Thanks.
I am. My apologies. I don't know what happened.
Thank you, Justin.
I'll finish up here real quick.
Susan, are you back on?
Representative. We too have been looking at only essential removal from the home on our delinquent youth. A lot of the emergency shelter cares are not accepting admissions currently. So while we always strive not to detain unless it's essential, more so even now we're asking parents and family members to step up to the plate and try to
Yeah, I believe Susan is on her Wi-Fi and it's knocking her off. Sorry for that.
Again? No worries. All right, Mary Beth.
Can you hear me? Okay, great. Good morning, everyone. And thank you for allowing me to present to you this morning. As you all know, we don't typically have just areas of our office that deal with children other than our appellate division. but we are a law firm, and we do many, many things that intersect with child safety and family stability. And so I'll go through some of them, but before I do that, I wanted to follow along to make sure I got the questions right. And it says, what's going well? And I'll say to you that I think that all the work that's been done with disaster planning as a state, all those COOP meetings that we've attended has really helped. The good news is that we are all working remotely and being successful at it, which is more than just working remotely. I feel, someone else mentioned it, I feel like I'm working harder, or let's say that's more efficiently than I do in the office. There's a lot of socializing going on, and I mean, those of you that know me know I'm a wallflower and I don't socialize well, but it's been helpful to be able to be stuck with just a schedule. So we're very, very productive, and I'm happy about that. I think the one thing that we've learned through all this too is that the COOP hasn't taught us how to come off of a disaster, which is what we're kind of all talking about. How do we get back into the office? Who goes back into the office? It's sort of like the 9/11 thing. Life has changed for all of us since 9/11. Going to an airport is a different experience. For those of you like me that are dinosaurs, I don't think going to be on this call is, but the days of buying the ticket without having your name on it. You could give an airplane ticket to a friend if you couldn't make the trip. So I think that things that when we get back to normal, so to speak, will be different forever after this. But we sure, as a state, have been prepared. The camaraderie and the cooperation and collaboration across state agencies, I think, is probably unprecedented. And it's been, in some ways, a very good experience. So let me tell you about what our office does to help families stay stable financially and in housing situations. We have a whole consumer protection division. There are 60 people in our office that are strictly devoted to consumer protection issues such as evictions, foreclosures, price gouging, things of that nature. I can tell you that on Holy Saturday night, I got a call from a legislator about someone in his district that was being evicted, and she was on a support system for breathing and things of that nature, and children involved too. And at that, it was like 9 o'clock Central Time. I live in Lake County, and probably within an hour, we had a court order to him where there had been an eviction hearing. The court had stayed the eviction hearing and set it for another hearing in June, but he was able to give that to the local sheriff or police chief to go out and prevent this person from being evicted. And so and I was proud of our staff because I reached out to people, and boom, just like that, I had all of that from them and a number for her to call first thing on Monday morning to make sure that everything went well, and it did. So our office is very, very involved with things of that nature. And the other financial stability issues that we deal with, we have an unclaimed property division. I'm sure most of you know about it. If you don't, we are the only Attorney General office in the country that has unclaimed property. And so we're very proud of that. In fact, we're #1 in the nation for getting money back to Hoosiers. We give back right around $1 million each week of money that this office, the office of the Attorney General holds. We have over $500 million that we are responsible for giving back to Hoosiers. Two quick stories. Somebody walked in into the office to deliver a package because our unclaimed property office is still open for our the workers that are taking the calls and processing the claims, and they had $30,000. Another person filed a claim based on some press release that we had to let people know, hey, there's money out here, and that person had an $800,000 what do you call it, estate that was left to him by a relative. And so sometimes it's just coffee money, but other times it's life-changing money. And so we do that as well. I would say how can we do better? I think that we just have to continue to work together, make sure we're following what the governor's executive orders are, making sure we follow what the federal government says is good for us to do, such as the CDC guidelines. And I think those will probably stay with us forever as we move forward. And last but not least, I will say to you that, first let me mention this really quickly. Last week, the office entered into an agreement, a settlement actually, agreement with Equifax. We are one of 2 states that were not involved in the multi-state settlement We have the highest settlement of any state in the nation, $19.5 million to Hoosiers. 3.9 million Hoosiers were affected by the Equifax breach. And the office, under the direction of the Attorney General, has directed that all $19.5 million go to Hoosiers instead of some other, sometimes you can put some as they call it a penalty fee. We opted that it would all go back to Hoosiers because within the next 45 days, they'll be able to claim that money. So we're really excited about that. And last, I was getting to the last but not least, our staff has collected, and we have volunteer staff members that are collecting it from our own staff members, over a ton of food to go to food banks and over $1,000 of cash donated to local food banks. And that's my report, Chief Justice and Representative Devon. Thank you.
I'll try one more time, just a couple of things. I just wanted to mimic what the Chief Justice said in regard to concerns over our clients with substance abuse and mental health disorders. Right now, we're trying to get them all the telehealth they can and all the online support groups. But with them being even more isolated, we do have grave concerns about their well-being. As far as returning, I think it will have to be a gradual return, and we are looking at a new normal. And I think the best way we can do that is to stay positive and supportive of clients, their families, and of each other. And I would just like to say thank you to the governor and Dr. Box and the whole state team. I think their updates daily and their kind words and support have been comforting and informative to all of us. So thank you so much to all. Thanks.
Thank you, Susan. Thanks for hanging in there. Keep coming back.
No,
Representative Summers,
to get the lesson.
would you like to share anything that's going on in your world and what you?
I'm a pretty much of an introvert, so I'm good. You know, the struggle for my constituents.
Are you getting most of your constituents dealing with?
We're definitely impacted by what's going on right now, and through this, I don't know if there's anything that we can change as we're going through, but make note of for the future endeavors in health for African Americans. It seems like, you know, of course, they always say when white America gets a cold, Black America gets the flu, and our numbers are greater during this health crisis. The relief from the federal government was helpful, not at all anywhere near helpful enough. I did have one of the lobbyists send me. Did you get it, Representative Devon? A whole bunch of hand sanitizer that I got to figure out who to take it to. I mean, a big case. Yeah, I got it. I'm just trying to figure out what to do with it. So
I haven't yet. No.
But
I've heard others that have gotten
it. So I can't necessarily be running around. So I'm pretty much locked in the house right now. So we're, you know, as far as answering, as a collective, the Black Caucus is answering everything together so that we don't individually, you know, have to take care of the processes.
Vanessa, Representative Summers, sorry. Yes. If there's any department that would want hand sanitizers or has a need, you'd be willing to
Yes.
donate?
There's one, I have a couple of community centers in my district, but I don't think they're open.
Very nice.
So you kind of, I don't know what to do with it.
Right.
Please call me.
All right. Well, if somebody's listening and they have a need, you might reach out to you then. Very good. Thank you for sharing. And is Senator Bro
No, I don't think we have either of
on
our
the
senators
line?
today. We had Senator
Really,
Houchin
is
for a
she?
while, but I think we have lost her, and Senator Bro had to cancel at the last minute.
No? How about Senator Houchin? Okay. And I'll just echo all the remarks and thank yous that people are readjusting their careers right now. And I know most of my constituents is dealing with, thank you to Hannah Joy, my LA, and our staff. And I'm sure Representative Summers would agree as well that our staff is taking a lot of the front of our calls and dealing very well with dealing with unemployment and workforce development type issues that are coming up as well. So I want to thank them for that. Well, next, we'll go to our philanthropic
Can
reports.
you all hear me?
So, Ann, are you ready?
Yes. Thanks. Well, thank you for the opportunity to brief you on the activities of United Way of Central Indiana and our response to this crisis. Our immediate response has really been threefold: to determine the immediate and emergent needs caused by the crisis outside of the direct medical crisis, so the human services needs. The second being the capabilities of the nonprofit safety net, human services safety net, to address those needs. And the third being really resourcing that safety net so that it can do its job, particularly in advance of any federal relief, which is the greatest relief that would be coming. So what's been most successful so far? It has been really quickly standing up the Emergency Relief Fund, which is the Community Economic Relief Fund that 6 funders, including very thankfully the Lilly Endowment, I know Ted's on the phone, on the video here, that we've been able to stand up with an initial investment of $17 million, which has now grown with public investment to $23 million so far. We've been able to quickly get $12 million out the door to 74 human services agencies in our 6-county area. And we've really focused that on the emergent needs that we have determined based on constant convenings of over 200 human service agencies over the last 5 weeks. And those have been most significantly in the areas of food supply, so food relief, child care for first responders, safe shelter for the homeless, domestic violence victims, and children of hospitalized COVID patients, disaster relief and infrastructure support, multi-service centers in neighborhoods, mental health, underserved and isolated populations, and people with disabilities. So I'd like to mention 3 of those in particular because they're ones where partnerships with state agencies really made them possible, and it just shows how important the partnerships really are to problem solving in this environment. The first was getting childcare up and running quickly for healthcare workers and first responders, and having the help of FSSA and really clarifying standards for safe care were really important. So we worked with agencies, United Way agencies, longtime United Way agencies like the YMCA and AYS and Early Learning Indiana, to really figure out how to take those organizations and then work with Indianapolis Public School System to figure out how to use their facilities, which were closed to schools, but really how to safely use those facilities. Also working with Eli Lilly and Company in the city of Indianapolis and the hospital systems to try to figure out what the demand was going to be in a very uncertain environment, but also working with FSSA to figure out what were the standards going to be. And then to get funding in place quickly so that we could figure out how to do it all, to get the word out, to get enrollments in place, and then to figure out how we would scale it as demand grew. So that was a place where it was absolutely critically important for us to work together. The second was quickly working with the Children's Bureau, FSSA, and DCS on funding for safe shelter as Children's Bureau started to get phone calls from the hospitals in the middle of the night and didn't have a place to send kids whose parents were being hospitalized with COVID-19, and so the kids were being forced into the child welfare center system, had been exposed to COVID-19 and didn't have any place to go. And so DCS was able to work on providing funding for Children's Bureau, and we were able to co-invest with them
in those new safe facilities. So again, a perfect partnership there and able to do it very, very quickly. And then finally on information and referral, Indiana 211 is for first-stop shopping for information and referral for families on where to get services. We are working very closely, obviously, with Indiana 211 and also with FSSA on that. And it is a two-way street. We have provided some additional funding for Indiana 211 so they can hire additional call takers to handle the tremendous influx of calls that they are getting. We are sharing the information we get from our convenings with Indiana 211 so they can have better information on the services that are being provided. For example, the community centers are providing more and more services every week, but they're doing it in different ways than they used to. A lot of it is outreach as opposed to bringing people into the centers because of the need to do it in its socially distant way. So they have to have current information about how to connect people to services. Similarly, Indiana 211 is providing information to us on what they're hearing. For example, I was on a call with them this morning, and they're getting fewer calls now because people are getting their checks from the federal government. So we will know when those checks start to run out because we will start to see higher volume of calls again. So very interesting there. I think as we move forward, I think we really believe in taking a whole family approach to support, which includes an emphasis on workforce for caregivers while investing in education for children and health, financial assets and social capital for the entire family to lead to improving quality of life and strengthen economic mobility. Each of these elements is going to be really important in this current environment, for example, with children needing e-learning support and parents needing to gain employment. We made an investment in the Indianapolis e-learning fund, which is really all about providing this connectivity and technology for kids in this e-learning environment, but we also recognize that connectivity is important for adults in those households as well to be relevant as we work longer term to get people reemployed and reemployed at higher wages. So that the things that we do put in place in partnership now really matter for how we come out of this in the future. And then the final thing I would say is that childcare will remain a critical focus because if we want to get people back to work and do it in a safe way going forward, we're going to have a place for kids to go if we want parents to come back to work. And we're going to have a safe place for them to go, number one, and they're going to have to trust that there's a safe place to go, number two. Finally, I would just say thank you to all of you for your leadership during this time in our state's history. We're all trying to figure it out. We're all doing it together. And your partnership with us on the nonprofit side has been critically important. We have enjoyed this and we appreciate it and we'll count on it going forward. Thank you very much.
Good morning. Yes, thank you. And thank you all for letting Ann and me sit in on this call and learn about the great work that you're doing. Thank you for your leadership. Thanks to Ann and United Way for their leadership here in Central Indiana. Appreciate the opportunity to share a little bit about what we've been up to and our perspective, much of which will echo some of Ann's remarks. Since mid-March, Lilly Endowment has made grants totaling $80 million to help a range of organizations address COVID-19 challenges, especially human service organizations serving the basic needs of children and families here in Indianapolis and across the state, Indiana, and nationally. Some of these grants include $18.5 million to United Way of Central Indiana for the Economic Relief Fund that Ann mentioned, $30 million to Indiana United Ways to help communities across the state respond to COVID-19, $5 million to the state of Indiana to deal with emerging challenges related to the pandemic, including helping the homeless population, and $15 million to the Salvation Army for emergency assistance to individuals in Indiana and across the United States. The endowment and other funders contributing to the above efforts have prioritized speedy development of funds of the human service organizations that deliver food for the hungry or offer child care for essential workers or otherwise serve vulnerable members of the community could act quickly to help people in need. The endowment has made most of this initial funding unrestricted and trusting the organizations well known for delivering services in the city and state to use the funds quickly and wisely. In addition, The endowment contributed $1 million to the Indianapolis e-learning fund that Ann mentioned earlier, which is another pooled fund to help Indianapolis public school districts and charter schools equip students with remote learning. This grant was made to Greater Indianapolis Progress Committee and is managed by the Mayor's Office of Education Innovation. These recent grants have been designed to meet the immediate needs of children, families, and individuals most severely impacted or likely to be impacted by COVID-19. Many of these needs have been mentioned by Ann and addressed by several of you on this call. Based on our observations and several discussions with relevant organizations, the endowment has several concerns about children and youth in our state and the agencies that are on the front line serving them. We're concerned about very young children whose cognitive development relies so much on the safety and nurturance of caring adults and child care and preschool programs, now close to them, many of them and their families. We're concerned about children in early grades whose reading, math, and social development are forged in the first years of school and are falling behind because school is closed. Remote learning is not very effective for children this age. They do not acquire these basic skills, it will be hard for them to catch up and master more advanced skills later in life. We're concerned about adolescents and teens, many of those who you serve, who need safe places to stay and mentors to steer them in positive directions, both of which are currently inaccessible to many. Many of these young people are facing loneliness, anxiety, and potentially dangerous environments at home or in their neighborhoods. We're concerned about young adults who are headed to college or are still in college or face the prospect of student debt in a murkier financial and employment environment. We're concerned about young people who need access to education and training opportunities that will be aligned with the requirements of jobs in a post-pandemic world in which automation and AI will be more prevalent. And finally, we're concerned about the parents of these children, young people who are now challenged with financial pressures and other stressors that bleed into family life. Many vital organizations that serve young children and their families and youth were in precarious financial positions prior to COVID-19 and now face existential challenges. They include child care centers, youth serving organizations, neighborhood centers, small colleges, and many other organizations that provide educational and supportive programming on tight budgets. Forced to close and losing revenue from canceled events and other sources, many of these organizations have cut programs, furloughed staff, assumed debt, and are now not sure how long they will survive. Although we believe a considerable number of these organizations are vulnerable, we do not yet believe that they make up the majority of agencies serving children and youth. There are enough, however, to cause alarm. Nearly all nonprofit organizations serving children are facing new and serious challenges, some of which have been funded by the endowments and other foundations, recent grant making, and we will continue to listen to their concerns and pay attention to the impact COVID-19 is having on their work. As we look forward to the recovery phase of the pandemic, we know much support will be needed for remedial programs to catch children up who suffer from lost learning, repair social and emotional damage caused by increased stressors of all kinds on children and families, respond to ongoing challenges and faced by young people who need to graduate from high school and seek continued education and employment, and strengthen the nonprofit and human services sector that provides important services in neighborhoods across the city and state. It will be important for funders like Lilly Endowment to understand how the public sector funds and addresses these challenges and how these funds are to be distributed, what policies might be enabled to support so we can figure out how to add value to addressing these challenges, and what is appropriate for philanthropic support. So conversations like this today is really helpful for us. We and other philanthropic organizations have come alongside the state to deal with significant challenges, such as our grants to Early Learning Indiana to help address the state's capacity to provide quality child care and early learning opportunities to families whose children need to learn and parents need to work. This was already a significant problem for Hoosiers that is now made worse and could impede children's development and parents' employment. Grants made in 2017 and 2018 through the endowment's Comprehensive Counseling Initiative provided funding to nearly 100 school districts and charter schools across the state to improve guidance counseling. Many of these schools identified mental health and social development as their counselors' foremost challenges. These counselors are concerned that repercussions of COVID-19 will cause even more problems in these areas. Helping vulnerable children has long been an interest of Lowly Endowment and agencies we regularly support, including the Villages of Indiana, Children's Bureau, Lutherwood, and Child Advocates serve children in the care of the state and that are at risk for abuse and neglect, as was mentioned earlier. Some of these agencies have expressed deep concern about the safety of children across the state. In wrapping up, we know from our work with organizations that serve children that these are complex problems. We're fortunate to have many hardworking nonprofit agencies and professionals in Indiana working hard to do much with limited resources. We think it will be important for there to be capacity on the part of the leaders of these agencies to chart the future of their organizations and work on behalf of children. They may need consulting, strategic planning, better data, and an understanding of the public sector support they may receive. We look forward to continuing to consider ways through supporting critical nonprofit organizations across Indiana to complement the efforts of the state to solve increasingly serious problems faced by Hoosier children. Thank you.
Thank you, Ted. Thank you for all you guys are doing. And I know Julie will share here in a minute. I just wanted to give a shout out to Representative Ed Clear and Representative Melanie Wright. I see they're on here watching with us. And just a really brief comment before we close. I've been working with Julie and Chief Justice and Director Stigdon on looking at summer study issues and moving forward. I think that might change with some of the COVID things that we're dealing with. And if you guys have suggestions, things that we need to look at or study, if you could let me know or Julie know, moving forward here. So we want to be effective, right? And especially with kids kind of stuck at home now and domestic violence issues, I think we need to look at possible ways. So I'm just going to be praying for you guys that God give you guys supernatural wisdom.
June 17th, I believe.
Julie, our next meeting is?
Yeah, we'll see how things unfold over the next month and a half.
I just wanted while we plan, while a lot of people were on it, I couldn't hear anybody. And then when people dropped off, then I could hear everything. So I was trying to read as we went along. But did anyone else have trouble hearing a lot of the speakers?
Is there any other comments?
Just put a thumbs up if you had trouble hearing a lot of the speakers. Mine completely went out. The sound did. So, all right.
Yeah, I did, in fact. I'm hoping the recording will be free of those issues, so once we post the recording, everything will be audible.
Yes, and if we continue to do this, maybe we can look for the headphones with the built-in mics. That helps immensely.
Great. Well, the notes, the captions were great. I mean, so I was able to, keep up. So thank you all. Safe. Julie, I've got to sign off now, so I'm going to say goodbye.